Hello, this is Ronnie Smith, the Acting Director of the Ralph H. Johnson VA Medical Center, here with you to give you another video update of what's been going on throughout the organization. Over the last week, we've had several significant changes, and so we wanted to walk through a few of those with you. First and foremost, you'll see that some messaging is starting to go out about moving to a universal masking policy for all staff that are working at one of our sites of care. As we learn more and more about COVID, we know we need to do everything we can to protect our staff and our veterans, so we're implementing this week a mandated masking policy. Now, we know we want to make sure we're also conserving the PPE we need for our staff today and going into the future. So there are several different levels of the masking guidelines. So I need everyone to make sure they're paying attention to those details and doing everything they can to make sure you get your mask, but use it wisely, and make sure that we can reuse those masks and make sure we can continue to conserve our PPE. Those staff that are working in higher risk areas, I'm working more directly with patients. We'll be getting 5 masks each week. We're asking each person to store their mask after each of their shift and then reuse them a week later. This is based off CDC guidelines that the coronavirus is known to live on most surfaces up to 4 days, so having a good safe 1 week margin before reuse, so it'll be safe to reuse. For those staff in lower risk areas, we're going to be providing a mask 1 per week for everyone, and then a new mask the following week, and then asking staff to save the masks that they had for the first week and use it on week 3, and then we'll be rotating through that. I know it's a complicated process, so make sure you are reading the details very clearly so we can continue to make sure we're providing you the equipment you need, but also making sure we're going to have what we need going in the future. N95s, no real change on how we're using those. We do have a good process in place. Big beneficial news for that is that we did get approval to start reprocessing N95s using our state-of-the-art equipment that our SPS already has. We can only reprocess them twice. A critical element for people to know is for staff that wear makeup, that we're asking those that would potentially be using N95s to not wear makeup, because if the N95 gets makeup on it, we won't be able to reprocess it. So we all have to do our part to make sure that we are using the masks that are assigned to us to conserve those, reuse them in a safe process that follow clear guidelines that are already established by the CDC, and make sure that we're using those safely. Now, we have seen staff that have brought in their own cloth masks to wear around the facility, and that's okay if you're not working in a direct clinical area. But if you are bringing in your own mask to wear and not using the mask that is assigned to you, so we do ask that you make sure that you take them home and launder them daily to make sure you're staying safe. We do not recommend that people reuse gloves of any sort. And also make sure that if you are wearing a mask, you want to make sure you cover your entire mouth and nose the whole time. Just covering your mouth and keeping it below your nose helps a little bit, but you're still going to be potentially exposed, and it's not going to give you the best protection possible. Other news is we've been working closely with our partner MUSC for their drive-up testing, and we're expected to be able to announce later this week that we'll be able to provide service to our veterans and our employees that may need screening to be able to use the MUSC drive-up testing, so more to come on that. And also big news is, as of yesterday, we got testing kits to be able to do coronavirus testing in-house using our Cepheid lab equipment that's currently here at the Charleston location. So this is great news. This is a 45-minute test, and so we'll be able to test a veteran that needs to be admitted before we decide if we need to move them to one of our coronavirus zones, and know if they're positive or negative right up front, so we can get them to the right level of care in the appropriate setting almost immediately. With this, plus the drive-up testing available through MSC, and then our partners in Columbia are getting in-house testing as well, our landscape on the ability to test and know results for COVID is completely changed, and we'll be able to make better decisions much more quickly than ever before. So we're very excited what's happening with lab testing across the board. The last thing I want to mention is that we've been starting employee town halls in a virtual setting. We had a great session with our outpatient nurses last week, and then we'll be doing another town hall here very soon with some of our staff at some of our all-site locations. We did set up an email group, VHA, CHA, COVID-19 Q and, spell A-N-D and A, at va.gov. If you have any questions, feel free to email us at that mail group. We've been starting to get a few questions, and we're going to be including those in all employee messages going forward. And in closing, I want to just say thank you very much for all you are doing. Some signs of all the social distancing everyone's doing out in the community, and everything we're doing here is starting to flatten the curve. It's no time to relax. We're still a long ways to go in dealing with this COVID, but I do want to say the signs of everything you're doing is making a difference, so please keep it up. That's all for today. We'll talk to you again soon. Thank you.